Shall I start?
Just start.
Hello, this is Dr. Trivedi, a doctor working in this clinic. May I confirm that I am talking to Jeremy Pope, 25 years?
Yes, doctor.
Yes. How may I address you?
Please call me Zren.
Okay, Mr. Jeremy. Today I am going to discuss about your health issues and some other things. Will that be all right?
Yes, doctor.
Okay. And during our discussion, I might take down some notes, which will be strictly confidential. Will it be okay?
Okay, doctor.
Okay. Mr. Jeremy, may I ask you at the beginning that how do you feel now?
Actually, doctor, I was not feeling well for a quite long time, and for that I visited my GP. He ran some blood test and also said that there's something abnormal with this test. And after this test, he also suspected that I have some problem with my defense system.
Okay.
He also wanted to do some test, but I didn't wanted that. And for this, I asked him to give me any medication that can improve my condition, but that is not improving my condition. I am even now I am feeling some weakness to my cough and fever has subsided, but I am feeling weakness, lethargic, and also I have some pain while taking food.
Yes. Well, actually, can you please tell me more in details? What were you told about the problem in defense system, and what test were you advised? If you don't mind, can you tell me?
Okay, doctor. Frankly speaking, that after seeing me, after taking my history and doing this blood test, they said that there was less blood that act as a defense system in our body. This type of blood cell is very much low than the normal. And he said that this can be problem with some problem in the defense system that can happen due to some cancer, and also can be due to a virus called HIV virus. And for that, he wanted to run the test for HIV. I asked him to run the test for cancer, but I didn't wanted to run the test for HIV at that time. I have some personal issue with that.
Yes, I can get it. I can get it. Well, actually, uh, if you don't mind, Mr. Jeremy, may I know that why you are not willing to run the test HIV test?
Doctor, actually, I told you that this is a personal issue.
Okay. I'm very sorry to know. But actually, may I tell you something about your condition now?
Okay, doctor.
Yes. Actually, uh, the symptoms that you are having at this moment, okay, it's not very much improving even after giving you some antibiotic medication. And we ran some tests and found out that the problem in your chest now is due to a specific bug infection. Okay, so it's called pneumocystis. Have you ever heard of it?
Okay, doctor.
Okay, actually, when this type of infection occurs, there can be high suspicion of weakness in your defense system, and actually, it becomes very important for us to rule out that bug infection that we called that HIV, because if we could confirm that, we could start a very specific
Okay,
treatment.
doctor. One thing. If you are suspecting I am having HIV, then just without this doing this test, cannot you start the treatment? Because you know that there are a lot of outcomes after the test results come. I may lose my job, and I will get humiliated in that society. and even I will be rejected by my partner. Cannot you just start the treatment?
Well, actually, I'm I will try to get to it one by one. Actually, the treatment itself at this moment we are not totally sure that whether it is due to the HIV bug infection. So at the beginning we have to be sure about it, because the treatment that we would like to give is actually very specific for that, and we should not start the treatment before knowing for sure what's causing your symptoms. Are you getting me?
Okay, doctor.
And
Then
actually,
you are just pushing me to do the test.
no. There is. I'm very sorry to say you that, but may I at this moment may I discuss you some more issues?
Okay, doctor.
Yes, actually, you told different some points here, your points of concern. Actually, uh, at this moment, I would like to address them one by one. Actually, this test, when it is done, it will be done under very strict confidentiality, and nobody else will know that you have been run the test. Are you getting me, Mr. Jeremy?
Yes, doctor.
Yes, and uh, it's and even if you and if you are found positive, then I cannot deny that there can be some implications on your job, but there will be very specific treatments as well, which can improve your health, and and may and improve your health. And may I actually assure you that actually, even if you had done some insurance before, okay, those won't be affected even if you come out positive. Are you getting me?
Okay, doctor.
And and uh, may I know that it's actually a personal question, that may I know that whom do you live with?
I'm living with my girlfriend, doctor, and I am living with her only for last 3 months.
Yes.
So if she came to know that you are suspecting condition HIV, she will even reject me. Even if it comes positive, then I can confirm that she will leave me forever. I am a very frustrated person, doctor. I cannot live without her.
Yes, I can get it, Mr. Jeremy. I'm very sorry to hear that. Well, uh, at this moment, I'm going to assure you that we are not we will not force her to tell anything about the test, okay? Uh, and we are not going to tell anything about the test to her, okay? It will be strictly confidential. But if you come out positive, actually, then it would be important for you to tell her about your condition, because then she might also get affected by you by a positive person. Are you getting me?
Okay, doctor. My previous doctor said that I will need to go for the contact tracing that whom I have had relation. They should also be tested, and that made me frightened, doctor.
Yes. Actually, it was not wrong to say that contact tracing should be done, but um, actually, may I add something to this now?
Okay, doctor.
Yes. Now, at this moment, actually, we would focus on your test. Okay. It first of all, it can come out that you are not suffering from this condition at all. So you should not over bother about it, but it's a high probability. So when we are running the test, it will be strictly confidential. Okay. Uh, we won't reveal it to anybody that you have run the test. But if you come out positive, okay, then it would be important for you to tell your partner. And I guess that because in that case, if your partner has any problems of this bug infection, she can be diagnosed at a very early level. And at this moment, may I ask that Does she have any symptoms, any of the symptoms that you have presently?
No, she's fine.
Okay, so if you come out positive, that question arises then, that if you come out positive, then it's important to test your partner, your present partner, and also doing some contact tracing as well, because uh, it's important to look whether they have contacted this bug or not. And if they have contacted, they can be started treatment at a very early level, which could be life saving for them. And I guess that you, as a human being, you would not like them to suffer. Am I right, Mr. Jeremy?
Okay, doctor. I got some hope.
Yes.
If the,
Well,
if this test come positive, then is there any good option that will improve my symptom and I will be normal?
well, actually, at this moment, it's a very early stage to be completely sure about your condition. First of all, we have to diagnose it. It might not be that bug infection, but however, the chest infection that you have got, okay, there is a chance, a high chance. We cannot refuse it at this moment. There is a high chance that you have got that infection, and if it comes out positive, then we have a very good team who will look into you, into your case, and we will try our level best to give you very good treatment. And in the recent years, the treatment of HIV actually has gone very, very good. So we would try our level best to treat you and make you as much free of complications. Are you with me, Mr.
Yes,
Jeremy?
doctor.
Okay. And at this moment, may I ask you some very personal questions now?
Okay, doctor.
Yes. May I know that do you share any needles, or do you take any recreational medication through your blood channels?
Meaning, yes,
Yeah.
doctor. When
Okay.
I was a university student, I did that
Okay. And have you been taking now these things?
occasionally.
Okay. Actually, this needle sharing or recreational medication through blood channels, this can actually pose a great risk for you. Okay. And even if you come out negative, if you come out negative, it will be very important for you to stop sharing this needle or taking medication through blood channels. Okay, because they can cause you have this serious bug infection in the future as well. Are you getting me, Mr. Jeremy?
Yes, doctor.
Yes. And may I also ask you some very other personal question?
Okay, doctor.
Yes, you told that you have been with your partner for the last 3 months. And may I know that do you use any preventive measures while being intimate?
Sometimes.
Yes, actually, I can get it. Actually, at this moment, it will be very, very important for you uh, to uh, to take preventive measures all the time. Okay, because if you come out positive, then and if you don't take any precaution, then your partner might get this from you. Okay, are you getting me, Mr. Jeremy?
Okay, doctor.
Okay, so Mr. Jeremy, uh, do you have any more concern?
Yes, doctor.
May I know?
How long will it take to come the test results?
Well, actually, usually the result can come within a very quick time, within a day or two.
Time
And
out.
okay. Hmm.
So, what was your task
uh, uh, the importance of doing HIV testing and meet its concern.
and what do you think? How far you could have done?
I think I had met his concerns a lot. His job issues, his insurance, and his social stigma, and also about um, his girlfriend issue. And I think I had tried to uh, I had tried to do something about her HIV testing as well, uh, so that he might does not get too much frightened. Okay. I have
What do
tried
you
to
think?
tell.
He has been convinced?
I'm not totally sure at this moment, but I think he got some hope.
Okay, that is fine. Anything you could have introduced, or or anything you could have explored if you had time?
Uh, well, I think I would have told that we would refer him to some sexual health clinic, and if he had ever been to any sexual health clinic before, and whether he had run any tests before as well.
Yes.
I
I'm coming
actually
to the
didn't.
yes, I am coming to the point that you could have asked other that is for this patient. First, the pneumocystis pneumonia was assumed, not confirmed.
Yeah.
Okay,
Mm.
so you
Mm.
said that it was confirmed.
Yeah. 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 Mm, mm, mm,
First of all, your introduction that was fine. Then your agenda that was also fine. That you are going to discuss this condition,
mm,
that was fine. And even they have asked how is he feeling now. That was fine. How far he know about his condition. That was fine.
mm, mm, mm,
And after that, you asked that uh, what test he have been advised, and he refused. That was very fine.
mm,
Okay. And after
mm,
that, you have asked that why he had refused.
mm,
Okay, before that you could give him uh, some information that could relax him. That like this, that okay, I can understand that this is a very shocking or distressing condition. A lot of people suffer. A lot of people get shocked when they are asked to do a HIV test because there are lots of misinformation about it. So they initially don't want to do this test. But when we make all this information clear to them, after that, most of them agree to do the test. And I hope that I am in a position that I can give you the best explanation, and I can explain this if you have any question. And after that, always you can accept or reject to do the test. But it will be it will be better if you can share your thoughts with us. Then we can give you the proper guideline. And if and also if in this time need help, I will take opinion from the expert, one who is expert on this testing. So that will be also very good thing for you, so that you can get more and more real ideas.
Okay, that's a very good point. Actually, that's a very good para
Yes.
that should have been introduced in this case.
And so that after that he would be happy to share his thoughts that why he is not convinced, why he doesn't want to do the test. Okay, and he will say, okay, doctor, I have a lot of questions, but I am frightened really about the test. What will happen if I come positive? Okay.
Mm-hmm. Mm,
And after this testing, okay, before I can answer this test, can you please tell me that how far do you know about this disease, about this condition, HIV?
mhm,
Then he will say, oh, doctor, I have heard that this is a killing virus, and I see on the TV that it kills everybody. There is a lot of okay, is it okay if I tell you more about this HIV?
mm,
This, then you can get a better idea. Okay, this is actually a bug that enters our body and it weakens our defense system, so
mm,
that we get easily fatigue, we get easily bug infection.
mhm, mhm, mhm,
And
mhm,
the good thing is that if we can detect this condition, and we have very good management plan that helps the people to lead a almost completely normal life with current medication. Adhering to the medication gives them a good quality of
mm,
life. You will get
mm,
okay.
mm.
And and also the frightening thing is that if it is not treated, then over the time it affects the people's immune system, so they get easily bug infection. And I am sorry to still you that with that they can die at a very early age.
Mm-hmm.
And then he will get the idea that what is HIV, and it has treatment option. At least he will know that, and at this time he will also be frightened that okay, without if I get this condition and I am not getting I do not get treatment, then I will die soon. That point, okay, he will say, okay, doctor, you
Mm-hmm.
can understand this, and it is hope that this is a good treatment option. Okay, then can you tell me that what will happen if the test results come out positive? And at that point, he already asked you, and at that point, you can say that okay, is it? Can I? And I tell you if the test results come out. Okay, if the test results come out, we will refer you to the HIV specialist nurse. He will review it and he will give you the good management, best management. Okay,
Oh, if comes out positive,
we will
refer
recommend
to.
to the there is a special clinic that is designed to treat this HIV patient. So they will regularly follow up you. They will regularly uh, check up you, and with that adhering to this medication, you will. It is hope that you will almost lead a completely normal life.
Okay.
After that, okay, will it affect my job? Okay, so if may I know that what do you do for a living? Then he will say I am a sales officer, marketing officer. Okay, at this point, it is uh, without actually this disease is spread through the blood and our body secretion. So, as you are not doing any job that is related to this, so it will not affect your job, and we are not going to disclose this condition to anyone.
Okay.
Okay. Then he will say, okay, it will affect my insurance. Okay, actually, coming positive with the ECB will affect your insurance in the future, and I can talk. And if you have any specific question about the insurance and what type of insurance, then I can talk to the legal authorities, and they will be able to give you the best explanation or best answer regarding that.
Mm-hmm. Mm-hmm.
Because
Yeah.
anyone will not take any life insurance who have HIV positive.
Mm-hmm.
And after that, okay, will you inform my partner? Okay, it is not our duty to inform your partner, but we will encourage you to inform her, because sometimes this condition can, you can, if you come positive, you will always have to show that yeah, there is also some of getting negative. That is okay. If you come positive, then there is chance of transferring this condition to her, okay, to your partner. And at that
Mm-hmm.
we will suggest you to tell her about your test results if it come positive, and so that he can get early tested and he can get any early intervention if he need, if they need, your
Mm-hmm.
partner need. Okay, then he will say, okay, I am very afraid that I cannot tell her. I will lose my family, I will lose my partner. Okay, this I can
Mm-hmm.
understand. This is a very difficult situation for most of the people who come positive.
Mm-hmm.
For this reason, we have faced all a lot of cases or condition like this. So we have a good team who are expert on how to disclose this condition to your partner, so they can guide you on that. And even if you need help, they can.
Sorry. Can you please repeat? Can you please repeat? I have missed this word.
Okay, we have good expert team who can
Mm.
tell you, or who can guide you how to disclose this condition with your partner, or even if you need help, they can also make an arrangement with your partner and they can also disclose with your permission in a very good and effective way.
Yeah.
So he will say, okay, it is a good news. Okay, after he will say more about other findings. Okay. After that, and in the meantime, I am going to give you some advice to follow up. Okay, lifestyle advice. I am going to give you some lifestyle modification advice. Do you agree, or do you want to know those? Okay, and this time we will encourage you to use condom during intimate relation, because as I told you that this can transfer by the body's secretion. And
Yeah.
also we will yeah, may I know that do you use any do you smoke cigarette? Oh yes, I will request, I will recommend, or I would recommend you to stop smoking, because it is injurious to the health. Can't may I know very personal question to you? Okay, do you take any blood thinning medication or any drugs through your blood thinning? Okay, then I will say I will not stop at taking those. I will say, okay, in this condition, actually, I would recommend not sharing those needle, because sharing those needle can also bring a lot of disease from another person to you, and also from you to another person. And
Okay.
if you need help regarding stopping those medication, taking medication, I can refer you to the respective department.
Yeah.
Then this time there are certain other question that, okay, uh, how did I got this condition? There are sometimes certain factors that patient have no history of sexual exposure, but how did he got this condition? Okay, at that point, or if he asks that, how did I got this point? Then at that point, you can tell the possible routes for getting this condition, or you can also can get this condition that this also can come through by needle sharing, through blood
Yeah.
transfusion. Have you ever had any? No. It can comes also by tattooing. Have you had ever any? No. And also it can comes by sexual act.
Okay. So I will have to ask all these things from my. Okay.
Overall, your performance was fine.
How fine? There could have been so many issues.
Okay, and in this time, you should always reassure and encourage the patient to ask more questions, so that
Yeah.
they got out of their fear.
Yeah. Yeah.
Okay, do you have anything to add?
No, nothing to add.
No, I am stopping.